joined here with Dr. Dennis Tirch. So Dennis is the founder of the Center for Compassion-Focused Therapy, the first clinical training center for compassion-focused therapy in the United States. He is past president of the Association for Contextual Behavioral Science and associate clinical professor at Icahn Medical School at Mount Sinai, New York. Described as one of the country's foremost leaders in compassion training and evidence-based therapy, he is an internationally acknowledged expert therapist, supervisor, and trainer in CFT, cognitive behavioral therapy, acceptance and commitment therapy, and Buddhist psychology. Dr. Tirch is the author of 6 books, some of which include The ACT Practitioner's Guide to the Science of Compassion, Buddhist Psychology and CBT, and Experiencing ACT from the Inside Out. His work has been covered by numerous media outlets, including The Wall Street Journal, The Washington Post, The New York Times, The New York Post, NPR, and Wired. You can learn more about Dr. Tirch's unique approach to clinical psychology at www.mindfulcompassion.com and follow him on Twitter at Dennis Tirch, Ph.D. So, Dennis, whenever you're ready, just feel free to get started and we'll get going.
Well, thank you very much, Niall. Thank you for the introduction and the invitation, and thanks to everyone who's here today together to do some experiential learning, experiential training around psychological flexibility in compassion-focused therapy, and added this concept of compassion and courage because I think it's really important for us to remember that compassion is not soft. It's not weak. It's not just warmth and flowers and self-care and, your security blanket. It's actually not at all those things in some sense. And compassion represents something that you're sort of is a birthright of yours, if you will, an embodied human motive that affects us on every level, from the moment you're born until the moment you die. Your experience of compassion, warmth, care, and loving kindness will affect your well-being, health, and functioning, from your immune system functioning to your heart rate variability, to your levels of depression and anxiety, your experience of stress, your experience of engagement with the world. And we know that compassion is a very important transdiagnostic factor that can further psychotherapy change and personal transformation, as is psychological flexibility, which is a specific way of looking at how to broaden human repertoires and live lives of meaning, purpose, and vitality that has emerged from contextual behavior science and ACT literature. I've heard Paul Gilbert begin sometimes by telling the group, this is a lot of material we're going to cover, and a lot of it can seem complicated, but don't worry if at first you don't succeed. Skydiving is not for you. Yeah. And it always gets a laugh in his wonderful style, but there's something in it that kind of, I think, decatastrophizes what our aims are together in this very short time to be able to learn something perhaps that can affect the lives of clients just that much more and help one another to move in a positive direction. So I'm particularly grateful for everyone. Good, as they say, good morning, good afternoon, good evening. There's so many different places and spaces that this group is sitting in together. Like this circle that we're sitting in is actually literally all over the world right now. So what a wonderful thing to have thinkers and caregivers and scientists, psychologists, teachers, people gathering, on a Sunday to just think about how we can contribute that much more to the alleviation and prevention of suffering. So it's a splendid thing. Thanks so much. We're going to be looking at a couple of aspects of compassion training that emerge in the compassion-focused therapy community, emerge from the work of the CFT, as it's called, founder, Dr. Paul Gilbert, Professor Paul Gilbert. And these two dimensions, these two kind of aspects of that work are compassion-focused therapy, which is a form of psychotherapy grounded in viewing compassion as an active process variable and in therapy, and an evolved motive that facilitates personal transformation. And compassion-focused therapy seeks to cultivate that quality in a psychotherapeutic context, either with individual or group therapy. And there's also compassionate mind training, which is a series of contemplative exercises, meditative exercises, and imagery practices that are useful for training the compassionate mind. We're also going to talk a little bit about acceptance and commitment therapy concepts, such as psychological flexibility. And one of our central premises is that both ACT and process-based behavior therapy, process-based CBT to some extent, both that school of thought, contextual behavior science interventions, and compassion-focused therapy, beyond the alphabet soup of FBI, IRS, KGB, MI6, DBT, CBT, ACT, CFT, all these different brand names that we do, beyond the distinction in brands and tribes. What we're going to be looking at is that compassion training and cultivating psychological flexibility are, in fact, cultivating a very, very similar, if not self-same. I think Siri wanted to join in our discussion somehow on this computer. Everybody wants in on compassion training. This is super great. We're all in together. We're all in the soup. So pardon that. Basically, the compassion training and psychological flexibility training are cultivating the same neural networks and the same verbal relational networks that represent the same quality of being, the same ability to face difficulty and danger, to turn towards those things that contribute to our suffering rather than move away from them, and to take meaningful action to alleviate suffering and contribute to well-being. I appreciate that you even greeted the computer's AI in this group, so thanks very much for that. That's very cool. So I'd also like to begin by acknowledging that in addition to CFT founder Paul Gilbert, or the founders of ACT, like Kelly Wilson or Steve Hayes, Kirk Stroessel and Kelly Wilson, in addition to just a hat tip to those academic, American or European scholars, we have to really take seriously that we're working with concepts and traditions that have been developed and cultivated in a community of wisdom traditions and philosophies and spiritualities, religions, social thinkers, as well as psychological scientists who test things and develop treatment protocols. We always like to begin, my partner Laura Silverstein Tirch and I, with something like a welcome to country, where we recognize, and just remember not just the originals, First Nations people who had stewardship over the land of where we're teaching from, and in this case, the Hudson Valley, New York, and the Lenape Native American society, but also our forebears and ancestors in intellectual, philosophical, and scientific lineages. So that hopefully we take a moment to recognize that none of this comes from me or from us when we teach. It comes through us, and it's a part of an interconnected human community of people seeking to take compassionate action and facilitate compassionate transformation in the world. So compassion-focused therapy itself, sometimes we like to talk about the origins of the sort of development of CFT, and Paul Gilbert is someone who has a history in economics and Jungian psychology and different schools of thought when he was a very young man going to school in Edinburgh, and then with the field moved towards cognitive behavioral practice and behavioral understanding of the mind in the sort of 80s, and particularly honed in on an evolutionary approach that appreciated an evolutionary functional analysis of human emotions and behavior. And in applying this evolutionary functional analysis to the development of human suffering and the development of human psychological problems like depression and anxiety. Paul wrote a tremendous book in I think 1989 called Human Nature and Suffering that really kind of put his work on the map. And a key feature of that book and Paul's earlier work is something called social mentality theory, which suggested that psychological science needs to look across different scientific disciplines. It needs to look into affective neuroscience, evolutionary psychology, and hierarchical social group theorizing, and things like primatology, to really appreciate what are the profound algorithms and evolutionary imperatives, the core survival motives that organize the behavior and functioning of a species, and in this case specifically of human species. This acute appreciation emerges in his writing and his work that our brains and bodies are not designed by us. They're designed for us through the process of evolution, with different trade-offs, different conservations, and different compromises. And the function of the design strategy, if you will, or the function of how human qualities and behaviors emerge, the function is to preserve the gene itself, the genetic code. It's as if the variation, selection, and retention that are the chief processes through which evolution behaves, right? Which the extended genome community behaves across space and time. Variation, selection, and retention will result in our having a range of experiences that we attribute to our own well-being, our own survival. It's as if our emotions serve some function that is about us as individuals. But at a very important level, all of those experiences were determined by what would contribute to the furtherance of life on this planet, and just the natural interaction of biological and even physical forces that bring forward the evolution of life. So that appreciation of evolutionary functional analysis, blended with the zeitgeist of the late 20th century evidence-based psychotherapy community, sitting inside traditions like affective neuroscience and such, which is sort of like, and very importantly, attachment theory. All of these factors establish like a context of thought, if you will, for someone doing clinical work, just like the factors in your life, and the factors in your society, and the zeitgeist and technology even contribute to the way you're thinking about your work here and now, that many years, 40 years later, 30 years later. And Paul likes to tell some stories, anecdotes about how, while working doing cognitive restructuring work, he noticed that there was a certain cohort of people who could challenge or dispute or reappraise their cognitions that didn't have much relief from depression or anxiety. And he began to notice like common features or common like ways that people were, ways of being when they didn't respond to the cognitive restructuring. And often that was reflected in the tone of the cognitive restructuring statements and cognitive challenges as they were called in the UK at that point. So perhaps someone would have a history of panic disorder, and they would be noticing that they have some anxiety and their fear of a panic attack. They would notice their negative automatic thoughts on a thought worksheet, and these negative automatic thoughts might begin with, oh no, your heart is racing, you're going to have a stroke, you're going to die, you need to get to the hospital, this is very bad. And they would look at the evidence for and against those thoughts, and oh, you've had many of these anxiety attacks, you don't have a stroke, when it happens, don't need to go to the hospital. And then the client would have a cognitive challenge or a new, more rational thought, and it might be something like, you're being ridiculous, why do you have to be so stupid about these things, this is a panic attack. Very condemning or harsh sometimes aggressive, kind of like an introjective experience or a self-condemnation experience that comes across. And it turns out that when people had a hostile inner tone, or they were in some sort of aggressive or activated kind of mode, they didn't really respond very well to cognitive restructuring. And also, when they're, rather than just rational, and certainly rather than the thought work, cognitive work needing to be disputatious, when people were able to address themselves with kindness and care and all of the qualities of a good attachment figure, when they could be a good parent to themselves almost, or a good friend to themselves, then different things became possible. Then the whole situation became very different. So this eventually led, to some extent for Paul, through some of the clients with whom he was working, like this eventually led to working with imagery from Buddhist traditions and from spiritual traditions, and specific practices and imagery practices, largely from Tibetan Vajrayana and Mahayana practice. These practices, which are designed to evoke and cultivate certain qualities of mind, certain, sometimes referred to as wholesome qualities. Those sort of practices, as well as some practices from method acting, all entered into this lexicon and toolbox and developing mode of working with suffering that became CFT. So it's a biopsychosocial approach. It involves specific schools of Western psychotherapy blended with contemplative traditions as well. We're working, as I mentioned, with an evolutionary model of human functioning, and that evolutionary model has specific implications for how much self-blame makes any sense and how much self-blame is functional. To recognize that we just find ourselves here with a brain and body that we didn't choose, but that we are responsible for dealing with and living with. We also have a model of affect regulation and compassion-focused therapy that appreciates the evolutionary functional analysis of emotions and the value of understanding through mind awareness, in addition to experiential mindfulness as a mode of being, mind awareness and a sort of a pursuit of the wisdom of the science and the wisdom of understanding compassion is suffused in this model of affect regulation and how we use it. And we're seeking with compassion-focused therapy to build compassion-focused motives, competencies, and identities, which means we're working to evoke and stimulate certain motives so that our behavior, our thinking, our feeling is organized by those motives, follows those motives. If you could think of being a very committed parent and a very proud and committed parent, and you are taking your child whom you love very much to a academic challenge, like a test that they've been studying for, that they could qualify to get into a certain school, and think about the sacrifices you might make. And then, let's say that the test was a long time and you're waiting there for your child and hoping, and you see the child coming out of the school building and looking like, wow, they've really put in a lot of work. And you meet their eyes, and what it would be like if you saw them smile with a sense of love and connection and a sense of joyfulness that you'd worked on something together. Think about what that would feel like in your body, or think about what it would be like to be on like a date with someone in the beginning of a relationship where you're falling in love and you can't wait to see them, can't wait to hear about what's been on their mind, about what their plans and dreams are in the world. And then if you think about like going on a really scary job interview, right? And you really need the job, it's really important, and it would really be a life-changing kind of shift in position. And when the person comes out to meet you in the waiting room, they look very terse and sort of scornful and sort of like unhappy to see you, and they ask a lot of probative questions, and you're feeling really anxious or maybe angry. think about how very different each of those experiences would make you feel. Think about the different thoughts they would evoke, the different behavioral urges, different motives such as competition, performance, pair bonding, romance, creating like a context for childbearing and child rearing, and then child rearing itself, and like loving connection and care and nurturance. These are all behaviors and repertoires and motivational experiences that are related to very different survival imperatives. And when we are in one of those sort of like states that are all about one of those motives, the motive itself can be understood as an organizing principle or an algorithm, which has certain interacting processes and qualities that are emergent. And Paul Gilbert referred to those as social mentalities, biosocial goals. So caregiving and care receiving biosocial goals and social mentalities evoke certain qualities, and we're going to look at those qualities. And in compassion-focused therapy, we understand compassion as being related to our evolved caregiving and care receiving motives, and the experience of compassion as being a sort of a way of describing what it is like to be inhabiting and proceeding from that motive, that caregiving, care receiving motive. So we learn to evoke and bring forth that motive, and we also learn to work with certain emotional systems, and emotions are feedback processes in this model, feedback processes that tell us how well we are moving towards those essential evolutionary imperatives. And there are also specific competencies and qualities that we cultivate using practices, specific practices. And this is where the blend of perspective on compassion and psychological flexibility really starts to take root, which is extremely important. The understanding that there are qualities such as contacting the present moment with a sensitivity to suffering, such as getting unstuck, unhooked, and defused from judgmental, categorical, evaluative thinking, and others which we're going to look at. There are certain competencies that we can train through self-help practices, through skills training, through meditation, mindfulness, imagery practice, and also in the therapeutic dyad. We can train this quality in the therapeutic relationship itself. And we also can use perspective taking, flexible perspective taking, something that is key to the psychological flexibility model, but that also relates to, very importantly, relates to how we can situate ourselves in a certain identity, how we can adopt consciously a perspective that is compassionate and flexible, and practice being able to see the world through that perspective. So we work with compassion-focused motives, competencies, and identities. We work specifically with self-criticism, shame, and guilt, specifically shame as a strategy around social threat, fears of worthlessness, unlovability, social exclusion, and a very natural response to trauma. And we work with fears, blocks, and resistances as to compassion and positive emotion as some of the key therapeutic aims. So we have a question from Shamash, which is, do you see acceptance skill from ACT model to be the source of compassion? I don't see acceptance as the source of compassion, but I see them as very related concepts in a very specific way. So we would understand acceptance as an orientation of awareness and intention, and that is a competency. It is a process, an ability, an attribute which will emerge from a person cultivating compassion and mindfulness. It can be an emergent competency, but it's also a competency that can be trained with specific practices in cultivating acceptance and distress tolerance. And as we take a look at the model, we're going to see the ways that these different levels of motives, competencies, and identities are trained, and also as they relate to acceptance, mindfulness, and all of the elements of the psychological flexibility model, like contacting the present moment, acceptance, cultivation of values, commitment processes, and so forth. So hopefully that will become clearer as we go. When we do the experiential exercises, we want you to remember that your work in experiential work is entirely voluntary. It's not, obviously, nothing here is compulsory. There's no way it would even be enforceable. No one is asking you or forcing you to, you should do this practice now. Because when you work with compassion, you work with your own suffering. Compatio means, in Latin and archaic French, to suffer with. That is what the origin of the word is, and that's a lot of what it represents. So we're going to do some practices together, and those practices involve touching your own suffering. So if you do so, I would ask you to only go as far as is really comfortable in your wheelhouse, like maybe a 1 to 2 out of 10 on how intense distress you would allow yourself to be intentionally touching. To recognize that we're not going to be doing any therapy or any ongoing program here, so we're just getting a taste, a little beginning of an exploration of something together. And it's sort of really okay for you to just listen and observe and really respect your own limits. If you go to a yoga class, the idea is to gradually explore flexibility and moving forward. It's not to rip your muscles by forcing yourself to touch your toes or whatever it is, or handstands. So do the same with your own emotional life and your own psychological integrity, please, together. So just, stay with this understanding that your consent to work together is your own to give or to take away. It's freely chosen, reversible, informed by what we're doing, and hopefully it's enthusiastic if you're going to move forward with these practices. If not, let yourself rest. And it's specific to what we're working with here. And this is also very important to remember for all consent in psychotherapy, to always be seeking consensus, seeking collaboration, seeking permission, and not inadvertently using stimulus functions of being the seeming expert in a context to unduly influence people to go places they're not willing to go. And this is also cultivating compassion. This is embodying the quality of compassion in the work that we do. And the compassion definition is an old definition that is stated and restated by Paul Gilbert as such: a deep awareness of the suffering of oneself and other living things, coupled with a wish and effort to relieve that suffering. And we often say now, alleviate and also prevent. To notice suffering and its sources in the world, and to be prepared to do specific things, to take action to alleviate and prevent suffering. And for our purposes, we're going to see also how suffering can be addressed with a spirit of courage. Psychological flexibility stands for an individual's ability to contact the present moment and everything that it contains, all the thoughts, feelings, physical sensations, as much as we can, and to be willing to experience difficult emotions, challenges, and to hold lightly all of these mental events as we adopt an observing perspective on who we are and how we are in the world. Flexible, observing mind perspective, connected to the present moment, willing to feel what is needed to be felt, holding lightly our stories about what could harm us or help us in the world. And from that more grounded and transcendental space, to continuously be the author of valued aims in our lives that we pursue, that we move towards through committed action, returning again and again to the pursuit of what is meaningful. Compassion represents this ability to be open to, sensitive to, and turn towards suffering, blended with a wish and a motive and a commitment to take action, to do something to alleviate the suffering. Clearly, these are different poems but very related poems in terms of the aim and also the qualities that are being trained. This relates very much also to the concept of courage, which I think is so important when we treat anxiety, and when what we're really looking for is the cultivation of expansive behavioral repertoires in the presence of frightening, anxiety-provoking, or distressing experiences which narrow our behavioral repertoires. And this actually does mean finding the strength and the stability and the groundedness to move towards those things that evoke anxiety, fear, or difficulty, and the ability and willingness to do things that are difficult or dangerous. And this link between compassion, affiliation, warmth, perhaps loving kindness, and flexible responding in the face of fear, I think is beautifully stated thousands of years ago by Lao Tzu, where being deeply loved gives you strength. Loving someone deeply gives you courage. And maybe in a CFT way, we would hear that as being deeply loved, experiencing a flow of compassion, loving kindness in, gives you strength, which we would understand as allows you the groundedness in caring motive with all of the attendant neurophysiological responses, such as the activation of the polyvagal complex, the oxytocin, vasopressin, and affiliative attachment-based networks in the brain. All of this provides you with the ability to respond flexibly and to move towards meaning and feeling what is known in attachment psychology as active safeness, the kind of experience of emotional safeness that allows you and encourages you to go out into the world and be playful and explore and face difficulties if you need. So being deeply loved gives you strength, and loving someone deeply gives you courage. When you are caring and grounded, and you put another needs before yourself, similarly, you experience this active safeness that allows you to face danger, to be courageous. And both of these qualities also involve a passive safeness, a groundedness, an experience of a safe base and a safe haven in attachment psychology terms. A safe haven where you can feel strength and the ability to recharge, and a safe base from which you can go out into the world and experience courage and face challenges. So all of this, I know you've been learning about the underlying neuroscience of attachment today. All of this is intimately related, and we can understand compassion as a multifaceted process that has evolved from the caregiver mentality and attachment repertoires, which we find in human parental care and child rearing. And we can understand that as such, compassion involves emotional, cognitive, motivational elements. We say in CFT that this involves primarily at first two psychologies of compassion. The first part of this definition representing the sensitivity and awareness of suffering, how to approach, how to engage with suffering. And the second part of this definition is ways to work to alleviate and prevent suffering. The first component being stimulus discrimination and detection, how to notice what's relevant in my environment. If I'm looking for food, how to notice what the food is and discriminate it from not food, so I don't go home and with a bag of rocks for dinner, like I'm able to know what it is I'm moving towards. And then the actual response repertoires in what we call the psychology of courage and dedication. What is going to be required for my mind, body, and behavior repertoires to realize this evolutionary imperative? So to summarize the first part of our work today, compassion involves a series of interacting processes, just like psychological flexibility. These processes can be trained, just like the different elements of the hexaflex and psychological flexibility model. This training can involve deliberate practice, multiple exemplar practice in different contexts, just like the qualities in the psychological flexibility model. And that shaping and solid behavior principles grounded in behavior analytic theory and theories of classical conditioning, shaping and gradually, selectively reinforcing successive approximations of a desired, more complex behavior. In this case, shaping the different processes, the different competencies in compassion, and shaping the different qualities of psychological flexibility. That this is a way of working. These qualities are the qualities of the compassion model. These are drawn from Paul Gilbert's writing. It's done some now validating the model with the compassion engagement and action scale that Paul Gilbert and colleagues put together, that we consulted on, and also our compassionate mind semi-structured interview, which is useful in assessment and case conceptualization as a way of working with the client to have a shared understanding of which of these attributes are more present for them, which of these attributes are less present for them. And so we can create a bespoke and specific curriculum, as it were, or set of therapy aims, and that will allow individuals to deliberately cultivate these qualities. And in compassion-focused therapy, and we've sometimes called our approach process-based compassion-focused therapy. It's interesting that we're also here with our good friend and sort of the person that we Laura. When I say we, it's not the royal we. I haven't lost it. I'm usually training with my partner, Dr. Laura Silverstein Tirch, and we run the practice and kind of like almost like a little training think tank here, known as the Center for Compassion Focused Therapy. So when I say we, that's kind of what I mean. So we had to Laura will often describe this in a process-based compassion-focused therapy, or those of our community who do compassion-focused ACT work will remind them that cultivating psychological flexibility and compassion can take place both from the bottom up, where you deliberately train each of these attributes. You do an assessment, a formulation of what attributes and what processes need to be trained, and we specifically work with distress tolerance training, empathy training, working with diffusion from judgmental, evaluative, and particularly condemning thinking. And we also sometimes train compassion and psychological flexibility from the sky down, as it were, rather than from the ground up, from the top down. Which what I mean is that you evoke, and using this here with respect to the historical Buddha, this is a symbol. It is a symbol of an awakening mind. It is a symbol of mindfulness and compassion and awareness. It's an old cultural symbol which has its origins thousands of years ago, probably in Vedic practitioners who first cultivated these modes of training the mind. And it's a symbol that has its origins in the historical Buddha, and millions of people and thousands over thousands of years of all genders and all ethnic backgrounds, but specifically Asia and India. This is a symbol of your awakening mind, of evolved human possibility for liberation from suffering and cultivating wisdom and compassion. The symbol has, what a symbol means is it's an image, or either an external image or a mental event, which evokes the stimulus functions of something in the world. So if you imagine your favorite food, for some reason I always think of lasagna, raised partially in an Italian-American household, so there's something about the Italian comfort food that I think of lasagna every time. And I said inadvertently, didn't even plan to do that. That is going to awaken all of the digestive processes required to eat that lasagna. So my imagining of the lasagna, the symbol of lasagna, influences not just my inner sensorium, like my imagination, but it evokes in the body behaviors, a preparedness to eat. Paul Gilbert often uses the example of sexual fantasy as something that can involve purely imaginal stimuli, which then awakens and evokes in the body a whole range of physiological responses and behavioral responses, as if you could actually, have sex or procreate there, with create offspring that's, not going to happen on your own. So even just the idea of sex evokes sexual responses. The idea of food awakens our, body to be ready for food. And unpleasant things, as we know a lot from psychotherapy, like the memory of a trauma, or anxiety about a test you have to take, or fears about what's going to happen with the end of lockdowns and pandemic restrictions, fears of pandemic restrictions. Any of these, many evocative and provocative ideas that can serve as a symbol, which will evoke our fear, evoke our doom scrolling on the internet, evoke our hiding, evoke whatever our prototypic responses to anxieties might be. And in fact, the word anxiety means a threat detection response based on a symbolic stimulus, whereas fear is a threat detection system response that is based in an actual real world stimulus rather than a mental event, an event in the world. So the repertoire narrowing and attention narrowing effect of anxieties, fears, and other threat responses like anger or shame will have an effect, a sort of always on, better safe than sorry, 24/7, 365 days a year threat response, which can respond to symbolic stimuli as if they were things in the world. And because we are the cooperative species who needs one another for survival, social threats will also evoke this hair trigger threat response that will hijack our entire body and mind and take over the whole scene, right? So that experience is often what we deal with in therapy. How do we defuse? How do we deliteralize? How do we cognitively reappraise? How do we help a person to not have worries, ruminations, fears, trauma memories, depression? How do we help a person to not have those experiences take over their whole lives and hijack their experience? So a lot of our work is in undermining the system where symbols and imagery guide and organize the functioning of the individual. Well, for compassion training and imagery training, we turn that process on its head. We actually use imagery that will intentionally evoke the qualities of doing and being that we wish to manifest, instantiate, and bring forth in the world. So in a sense, we do what an actor would do, is we create a character, like in the case of compassion training, compassion focused training, compassion mind training, we create a being, a compassionate self, a compassionate ideal. In spiritual traditions, that work is done for you. There's a bodhisattva or maybe a nature deity in shamanic or animistic traditions, or in traditions of the book, Judeo-Christian, or some Muslim sort of forms of mysticism, that there is like a saint or an angel or a being or an aspect of the divine in Kabbalah, that we are using that as a symbol that will evoke the qualities of being that we're wishing to bring forward. And in compassion-focused therapy, as a secular tradition without an ontological requirement or, a deity or deities, in compassion-focused therapy, we're working with individuals so they can cultivate tailored individual imagery practices that are secular, that evoke and awaken their compassionate mind and allow them to practice being the version of themselves they most wish to be. And we know that neurons that fire together wire together, and through work of a lot of wonderful researchers at the Greater Good Science Center, Stanford, CCARE, Richard Davidson's lab, James Kirby's group in Brisbane and work in London with Paul Gilbert and our colleagues in Portugal like Marcelo Matos. All over the world work, and of course the Mindful Self-Compassion group, this kind of work which evokes imagery, and we explore that after training in compassion, people cultivate qualities of prosociality, psychological flexibility, greater mindfulness, and an enhancement of these qualities. So we can see this in behavioral research, we can see it in outcome research, we can see it in psychotherapy process research, but we can also see it in the neuroscience and neuroimaging research, also some work involving Matthew Ricard, and where the brain of someone before and after compassion training over time looks different. And this wonderful, you may have heard about lots of research which looks at training in music and training in complex skills, where after a certain amount of training, the brain begins to look like the brain of someone training in music. It starts to look like the brain of a musician, if you will, like the areas that are involved in playing music, hearing music, discriminating different tones, understanding the symbols of sheet music, and specifically the sensory map and understanding of like kinesthetic functioning, all those structural and functional changes which are observable. And the same thing is true for compassion training. So when we evoke compassion imagery from the top down, we bring forth these qualities, we cultivate them, and we see them growing. And these are also the qualities of psychological flexibility that we see developing. So we can go from the top down, we can also go from the bottom up and individually formulate, assess these certain qualities, how they can be cultivated, and we can work with them so that they grow, so that if individuals have specific blocks in certain areas, we can help them. So as the wonderful Niall McKeever explained, we have 45 minutes, in this case 47 minutes, and then we'll take a 5-minute break. So at this point, we're going to take a 5-minute break. If there are thoughts or questions you'd like to put in the chat box, feel free to do that, and I'll respond to some of those questions when we return. But for now, let's take 5 minutes. So hope you enjoy your little break, and we'll see you shortly. Hello again. Good to see everyone. Well, good to see that everyone is here and that I can't actually see you. But nice to know that we're here together sharing this work. So a couple of questions. Shamash says, what do you say to clients that say, I'm not good at imagery and visualizing? Okay, it's an important question, and the company answer, the favorite answer for behaviorists is it depends. So it kind of depends a little bit more on the function of that question, like why is the person asking that question? And I would want to kind of respond in a way that met that function. So if it was somebody who needed us to slow down and have an experience of care and kindness in just the process itself of embodying compassion and training it through the psychotherapy relationship, well, I would want to address it in one way. But if we were thinking of it that just prima facie, like at the face level of this, well, what we usually say is to help people understand that even though we're at the age of the retina screen and HD, 3D imagery in our technology, that imagery really doesn't have to be some specific, elaborate, complicated imagining. It's just using our minds to evoke something that imparts and stimulates the qualities of compassion and psychological flexibility within us. So basically, we'll sometimes ask people, okay, hey, can you think about what's in your refrigerator and have them describe that? Or, what does your kitchen look like? Or what does a bicycle look like? And if they can just describe briefly those kind of qualities of something and remember it, we'd say, well, that's all we need. It's just some way to use the mind to bring forward the symbols that evoke compassion for you. And there's a lot that's been kicking around in the internet about aphantasia and people who report difficulty with in creating visual images. I want to be respectful of all the different capacities people have and all the areas that are trickier for them on a person-to-person basis, person-by-person basis. But we want to just help someone to decatastrophize just the process of imagery and realize it doesn't have to be so sophisticatedly complicated imagery. The difference, Sue mentions to you, the difference between anxiety and fear. She has spider phobia. Would you say that have anxiety about spiders and then a fear when a spider actually shows up? That could be a good way to look at like the anticipatory anxiety, particularly if you're in a very low incidence of spiders environment, right? And if you're just like, you're like on a plane and you're like, you're thinking to yourself, I wonder about spiders, and you start to feel like anxiety about spiders, maybe that's anxiety, right? But if you are, there's a spider, it isn't actually, there's a spider crawling across the computer screen, and that now we have fear, and it's a verbal distinction, but it can be a useful one sometimes. Donna asks, would you be able to use the discussion of art, drama, music, and metaphor within CFD to access and help clients who find visualization difficult? Well, certainly, Donna, that's great. And one of the things about compassion-focused therapy is, and Paul likes to say this a lot, is compassion-focused therapy. It's not compassion therapy, which means we're bringing a focus on cultivating compassion to the therapy that we do and the ways that we work. And that can mean lots of things. That can mean like lots of different things for different people at different times, right? So you want to work with, for example, in CFT, we have lots of techniques. We have chair work techniques. We have letter writing techniques. We have exposure and response prevention techniques, imagery, thought exercises. Paul likes to say set pieces, which are specific exercises for the room. And then in ACT, there are metaphors and stories and so many different ways of working. And I find, as a supervisor, trainer, and of course as a therapist, because that's mostly how I spend my time, that the key is to have a case formulation that's grounded in an understanding of the person's learning history, their attachment history, their capacities in emotion regulation, which understands a functional analytic perspective on their personal history, on the evolutionary functional analysis of the emotions, and works on functional analysis of the behaviors that are showing up in the consultation room. If you have those qualities accounted for, those processes accounted for in your case formulation, and you're selecting intelligently, collaboratively, processes to cultivate those qualities, to cultivate psychological flexibility and compassion, and tethering that pursuit to what matters most in the person's life, what their aims are, and tethering it to behavior change over the course of therapy, but also session to session. We have, Laura and I, in our compassion-focused protocol that we're studying local researchers at King University with wonderful group of people. They're looking at individual therapy and compassion-focused therapy for ACT practitioners, and we're looking at like session-to-session behavioral experiments, behavioral activation, and small steps that an individual can consistently take to move their life in the direction they want to go. Totally in tune with the psychological flexibility training idea of pursuing valued aims, totally in tune with compassion training and using compassion to ground and stabilize in the presence of difficulties so that we can be psychologically flexible. So if you're doing all of those things and you're using metaphors, you're using art, you can meet the person where they are. They don't have to be ace meditators, and they don't have to be really good at like Socratic analyses or any of that. All they have to be is who they are. All they're suffering with is the human condition. So we ground ourselves in that de-shaming, de-blaming, and destigmatizing orientation, and we work collaboratively and intelligently, if you will. Like what I mean is we're aware of what processes are helpful. Then we can tailor, and treat the individual with respect and integrity and compassion. And that's super important. That's just really, really important. So what we're going to do is we're going to do a little practice piece together, and we're going to do a version of the compassionate self exercise, which will serve as a review for some of you who've done compassionate imagery, and it'll serve as new learning to those of you who have some background in compassion-focused therapy. Deborah asks, is CFT a more directive approach? I think of it as a collaborative approach more than a directive approach. You know, we will discuss specific steps that a client can take, but I'm not directing them. I'm a bad director. You know, the joke that actors say, all I ever wanted to do is direct. That's as a therapist, that's not what I wanted to do, was to direct. I wanted to maybe be a fellow composer, a fellow actor, a mentor buddy, you know. But if I embody any authority in the therapy relationship, it is assuming a virtue and evoking compassionate authority to share a circuit, a neuroempathic circuit of compassionate authority to help the individual cultivate inner authority and the inner groundedness and freedom of their own compassion. So we have a practice which is sort of similar to Tonglen, but it's also practiced in Vedanta and yogic traditions of, you know, breathing in compassion. It's also in mindful self-compassion as well as CFT. So breathing in compassion for ourselves and breathing out compassion for the client or the other. Breathing in compassion for us, breathing out compassion for the other. And that's sort of huge. That stance, that way of being, can blend with helping the client be the author of certain valued aims, helping them to hold accountability and commitment to valued directions, serving as a resource for them as they brainstorm and review options, being almost like a consultant. And in fact, a fair amount of my week is involved in mindfulness, wellness, and performance coaching for people in business. And that involves, it's not directive. If I'm talking to a manager of a green investment fund, like, I'm not telling them what to do in their business, but we are working together to cultivate the most adaptive response to stressful situations. So thank you for the question, though. So as we begin this experiential practice, we're going to learn some of these qualities through the imagery practice, through the contemplative practice. So I'm going to ask you to take a moment, find a comfortable place to sit and get grounded. Elizabeth asked, might this exercise help in the therapy room when the client has disclosed some painful trauma that has impacted the therapist? That's a good point. Yes, I think it is useful for that. I'm just getting up to make a couple of adjustments. Okay, very good. Putting on a little white noise generator and making sure that we'll, pardon me for a moment. Just taking a moment to be attentive to the settings so that we're less likely to have outside noise distract you from your practice. Although whatever arises in our meditative work, or imagery, or mindfulness practice, we want to be able to be open to it. And, you know, we're not becoming the wise person on the mountaintop. We're having what Paul Gilbert calls the courage to descend into the reality of human experience. And in Dharmic traditions for a long time, you know, compassion is not an ascent, it's a descent in a sense. It's what Reggie Ray, the Buddhist teacher Reggie Ray, calls waking down, not waking up, but becoming intimately connected with our experience. So we're going to begin with a practice called centering rhythm breathing, or sometimes soothing rhythm breathing in CFT, where we're getting grounded and engaging stabilization and using the rhythm of our breathing, things that we see in pranayama and many other techniques, and also in coherent breathing or cardiac coherent breathing techniques that invite more parasympathetic nervous system engagement and experience of homeostatic groundedness in the body, and that can increase our heart rate variability. So that element of slow breathing blended with an experience of classical mindfulness, mindfulness in Buddhist Mahayana traditions and Dharmic traditions, of course, it is understood close to the John Kabat-Zinn definition, where there's the kind of awareness that emerges from paying attention in the present moment on purpose and non-judgmentally. But there's also a quality of remembering to pay attention that's in the definition, like remembering to pay attention in the present moment on purpose and non-judgmentally, with an awareness of an understanding of being and non-being, of who we are and what is and what is not. So there's a cultivation grounded in a perspective on being and the flow of being here now, which is grounded in slower breath and an intimate connectedness with this present moment. There are two major forms of meditation which are sort of like blended to some extent in Western mindfulness, and it's shamatha, dhyana, zen, or concentration meditation, where you're pursuing a one-pointed focus, and vipassana, or insight meditation, which is more common to Theravadan traditions, which is observing things just as they are, and from a position of reestablished and ongoing establishment of equanimity, and observing awareness, to some extent moving towards choiceless awareness. Mindfulness in the West is more about that wide angle lens, usually the way it's taught, of vipassana meditation, but there are elements of groundedness and more of a Mahayana Zen focused. I'm a practitioner, a long-time practitioner, more in the Zen lineage, and this sort of focus kind of is a big part of the way I've always approached mindfulness training. This is one of the reasons why I like the centering rhythm breathing that we use in compassion focused therapy. So we'll have some of the, in our little bento box today of tasting different elements of this, we're going to have some of the centering rhythm breathing, and then the subsequent practice, a brief version of our safe compassionate space exercise, where we ground in a safe space and using imagery to imagine we're in a place that manifests and like represents compassion. And then we will move towards our compassionate self practice, having a taste of creating an image of a ideal compassionate version of you that you will interact with. And we'll be using a little bit of shifting perspective taking and a time travel exercise, which you'll find sometimes in acceptance and commitment therapy and psychological flexibility training. We do a version of this in our book, the Experiencing Acceptance and Commitment Therapy from the Inside Out. There's a couple of analogous processes. And the reason I'm asking you to dive in deeply and do this blend of these exercises, this is one of the more advanced exercises in a way. This would be if you've been going through compassionate mind training and you began with psychoeducation, you did some of the breath training, safe space imagery, compassionate self imagery, and then using the compassionate self. So we're beginning at the end of the novel, or one of the later chapters, because I want you to have a taste of how these experiences that we touch relate to psychological flexibility and adaptive responding to challenges, and to see what the qualities are like for you. So if you will, we'll begin by establishing a collected state, gathering our awareness. So if you are sitting in a chair, feeling your feet on the floor, feeling your feet on the ground, bring part of your attention to the soles of your feet. And if you're on a cushion or a chair, your legs are folded, just feel your contact points of support. Allowing yourself to fall silent and fall still, allowing your eyes to close. Now bring part of your attention to the top of the head. And to everything that's in between, to thoughts, feelings, physical sensations. Now bring part of your attention to the sounds that are in the room around you. And to the sounds that are farther away even than that. And with your eyes closed, breathing in slowly, knowing that you are breathing in. And breathing out and knowing that you are breathing out. Resting in the breath and holding yourself in kindness in this moment. And with each out breath, slowing the breath. The breath slowing down, the body slowing down. And the body slowing down and the mind slowing down. Listening to the tones of these symbols, and as the third tone fades into silence, allowing that to wash over you. And resting in the breath. And as you breathe, it's as if you're breathing awareness into the body. And as you breathe out, it's as if you're letting go. And finding a point in the breath where you can vividly feel the air moving in the body, the energy, presence of life in the body. You might breathe in and feel the presence of life moving through circulation, through the surface of the skin. You may notice the cool air on the in-breath, or the release of tension and the warmth of the out-breath. And ground yourself in that breath. Whenever your mind wanders away from the breath, returning again. Simply returning your awareness, noticing that the mind has wandered and returning your awareness to the breathing here and now. Coming home to this moment, here and now. Imagining that around you, you're sitting in a place that symbolizes and manifests compassion and safeness and warmth, emotional warmth. This could be a place of great beauty in nature, beside a lake or a beach, seeing the dancing diamonds of sunlight on the water surface. Could be a place at home beside the fire, a safe indoor space, comfortably in your favorite chair or sofa. perhaps just resting on a sunny day. This safe, compassionate space is yours and yours alone. It's for you. Exhaling and feeling yourself heavier in the chair, you can feel how this compassionate, safe space invites you in, it welcomes you. You're coming home to this moment. Imagining that just a few feet in front of you, it's almost as if there's a smoke or like a heat haze in the summer. You see the way heat causes this little rippling of the light, and gradually a figure is coming into focus a few feet in front of you, and you recognize this figure as your compassionate self. This is a version of you that has qualities of wisdom and strength and commitment to be caring. It's a version of you that holds you in complete kindness and unconditional acceptance. This version recognizes that we don't choose our crazy brains, we don't choose our upbringing or our ticket in the genetic lottery, that we have brains and bodies that have evolved for hundreds of millions of years. And we're not designed by us, they were designed for us. So much of what causes your suffering is not what you chose and not what you would have wished for. And it's important that we recognize the wisdom of the compassionate self is that it's not our fault. Yeah, we take responsibility, we take action as best we can, but our suffering is not our fault. And when your eyes meet the infinite warmth and care and respect that you see in the eyes of this compassionate version of you, when you see the soft, warm smile, this part of you knows who you are, accepts you just as you are. This intimate care, and nothing matters to this being as much as your flourishing, your well-being, your protection. You can imagine this being as part you or part wherever the mind evokes, whatever you need that is symbolic of compassion, wisdom, strength, and commitment. It could be an older you or a younger you. It could be any gender. It could have elements of spiritual symbols and characters, or characters from fiction or history. Seeing the way the clothes hang on this being, the vitality and presence reflected in its presence. Just remaining in the warmth of receiving the compassion from this compassionate aspect of who you are. And allowing yourself in this moment to feel as if the compassionate self is being poured into your body awareness, and you're becoming this compassionate version of you. It's as if we could pour this awareness into the top of your head the way we would fill a tall, clear glass of water from a tall, clear pitcher. With every in-breath from the ground up, you can fill the body, filling with energy, filling with awareness, up through the legs and the core, all the way to the top of your head. So that in this moment, the blood that is in your veins is the blood of the compassionate self. The heart that's beating is the heart of the compassionate self. That you are becoming this compassionate version here and now. And this compassionate version of you has a wish and an intention for the parts of you that are suffering. The wish is that you might have this suffering relieved, and that you may be well and you be free. So here in this safe space, through the eyes of this compassionate self, in your imagination, forming right in front of this compassionate version of you. You see your past self. You see a child version of you. And you've traveled backwards in time, following this silver thread from your heart to every place you've ever been, every person you've ever been. Moving back like a bead of water, a bead of dew on a spider web, your awareness moving back through space and time. And seeing this version of you. And it's a version of you when you're very young that has just witnessed someone you love in a state of suffering. Perhaps a relative that was distressed or struggling. But we've moved back in space and time, and your compassionate self can look into the eyes of this past you, all the innocence and beauty that are in these eyes, and see the pain behind the poison. See how this past version of you has noticed suffering and feels motivated to do something about it. Remembering a time when you were moved by the suffering of another as a young being. And as you look at this past version of you that perhaps was scared or sad or needed help or nurturance, here now you are the compassionate presence that that child needs. Breathing in and filling your reservoir of compassion and presence, and breathing out and sending to that child love, care, and intention for support. And sending this wish, imagining the words that I recite or your version of important, loving intentions, we send to this past self a wish that they be well. May you be peaceful and at ease and protected. May you be well. May you be filled with loving kindness and compassion. May you be happy. May you be filled with loving kindness, compassion. May you be free from inner and outer harm. May the parts of you that resist compassion, may even they come to rest and know peace. May you be well. May you be filled with loving kindness and compassion. May the sources of your suffering come to cease. May you be released from bonds of struggle with suffering. May you be well. And resting in the breath, feeling your feet on the ground, your seat in the chair, your back straight and supported. With each out-breath, releasing the imagery practice. With each in-breath, feeling awake and alert and alive. And with each out-breath, being supported, confident, stable. And gradually releasing the images, resting in the breath. Hearing the sounds around us in the room. The sounds that are farther away. And then the sounds that are farther away even than that. Listening to the sound of the cymbals chiming 3 times. And as the third chime fades into silence, releasing this whole practice, breathing out, stretching if you need, and then we'll return to our conversation. So exhaling, again, stretching a little bit if you need, exhaling, coming back into the room. And we're going to have, in a moment, some, in the chat, some debriefing. But first, I'm going to type 3 reflective questions, and I'd like you to take about 3 minutes after I send them to reflect on each of these questions and do a written reflection. It comes from the work of James Bennett Levy, who wrote a book on CFT and personal practice and self-reflection with Russ Colts, Tobin Bell, and Chris Irons. This is a self-practice, self-reflection approach. So we do some reflective writing to consolidate and really make the most of our practice. The first question is, what was your experience of this exercise? And 2, how do you understand this experience? And 3, how can you use this understanding to practice compassion and psychological flexibility training in your work? Okay, so if you could take about, say, 3 to 5 minutes and mindfully, with an experience of like connection to your body in the present moment, perhaps writing or typing, just for yourself. I'm not going to send them to anybody, like a reflection on these 3 questions. So we'll take that time. So letting the words fall away, exhaling, and putting the written reflection component aside. Although I suppose this is also written if you're writing in the chat box. Let's just take a few minutes, and I'd love to hear any of your observations, as we say in mindfulness and acceptance-based work. What did you notice during that practice? So if you would be so kind to just, and don't be shy, also because we're in the interest of time, just feel free to type any of those observations in the chat box. It would be deeply appreciated. We have 108 people at the moment, which is a hugely significant number in Buddhist traditions and Dharmic traditions, so that's a good sign. So please just put them there. Kurt writes, Josiane wrote at peace. Kurt wrote exhausted, nourishing, we're all suffering, fair play. Ruth writes relaxing, but also precipitatory anxiety. Felt peace, confidence, and forgiveness, as Brian experienced. Yeah. Helen, letting go of blame. Katie, describing feeling peaceful, enjoying the imagery, getting a hug from herself, important. Kurt, experiencing lost connectivity, which is something that can be evoked when we face these experiences. Elizabeth was mentioning it's emotional. And Marco mentioning, for me, observing rather, answering the second question was like a mixture of a bridge of affect and self-soothing, pretty good. So for many of you, this idea was grounding, and some it had a provocative dimension. David mentions images of his child that he'd never had, he contacted, and that can happen. Diane describing timeless and drifting in spirit. That's also that can sort of happen. Sometimes a parietal lobe, to put it in biology terms, the timekeeper in the brain slows down a bit. And also from a more philosophical or psychological perspective, we have a sense of flexible experience of time perspective. There's some tiredness and cleansing and peace that Lynn reports. Lisa couldn't identify anyone who's looked at me with that full compassion, which can come up for us, right? Our learning history. So my heart's with you. It's provocative observation, important. And calling this person into being in yourself is beautiful. Thank you, Lisa. Bringing it for yourself, with yourself. Mandeep describing a calming and grounding experience. Nima mentions not a therapist, recommended this course by a therapist, but doing the meditation made me feel anxiety and a tightness in my chest. In the beginning, there's a lot that is associated and interwoven with our experience of compassion. So we will encounter and open to the range of different emotions. And sometimes they're the emotions that we're habitually taught to avoid or move away from. So I appreciate your courage and your honesty and openness in the report, Nima. Philip mentioned sleepy. And Quintus says, I'm not sure that we're all suffering. Compassion, and sometimes in some traditions is more about allowing a being to reach its true meaning. And Quintus, I get that, and I think that's one sense of what liberation from suffering means. You know, Huayan tradition in Zen, that tradition learned a lot about the sort of simultaneity of like one dimension of our being. Of course, if we're experiencing things as verbally mediated through this vessel of a human awareness, then our experiences will involve the inherent aversive experiences that, or at least initially balanced as aversive, that we describe as suffering and struggle. And that one layer of transcending suffering and liberation from suffering is not just the alleviation of the literal experience of the adjutant, but shifting a perspective towards fully apprehending our true meaning so much that when we really understand our nature as a living, interwoven part of a whole, of a oneness, then we reach more what our true meaning is, or we experience an approximation or a meaning more better suited to our nature. And that does involve like an alleviation of suffering. So good point. Donna mentions regression and then acceptance of the self, very emotional and soothing. Diane describes stepping into the safe and quiet zone. Helen feeling some love for herself. The difference between hypnosis and meditation, I think in some ways has to do with the intention. And meditation is a very broad word that means many different practices. And hypnosis is usually referencing a specific set of practices that certainly could be understood as being contemplative and meditative in some ways. So I guess it depends on the hypnosis, and it depends on the meditation, as well as depends on the person practicing hypnosis and the meditation practitioner. So thank you for the question, Leonie. Fiona felt emotional and loving. Mariana says, I have a body status tracker and I use it to track my heart rate variability, skin temperature. Temperature went up significantly, and apparently your hands get warmer when you're relaxed. Wow, okay, thanks for that observation. The data, bringing the data. I notice when I do this activity, I go to a place I've never been in the physical world, but it's very familiar to me, a river with a backdrop of a forest sitting on a large round rock. So your mind knows what to do. It feels like home takes you to a rainbow of colors, very intense, and meeting yourself. Yeah, some of us will have more vivid visual experiences like our friend Sue, and others it will be more sensory or more in the emotions, but we're all finding our way to evoke this experience. Lynn reports feeling compassion and a very deep experience of releasing. And Diane mentions that with a particular client who's so full of shame, it's hard to be with her sometimes. So part of this is cultivating our ability to hold and be with others' shame and suffering. Neil mentions liking the start, liking the chimes, the sounds, but wanted more silence to create space for me to do the work of feeling quietly. Yeah, I get that. It's tricky. Focusing on the breaths makes slightly panicky at some point. I can't breathe naturally anymore. Tightness in the chest, then it eases again. Get caught up thinking about the words and definitions and my understanding of what compassion means, the extent I like or don't like the sound of the word. I hear you. Yeah, the mind and body doing all of what it's programmed to do, its default thing, and that's natural, and that's part of why this is a practice. It's gradual, it's iterative. You're going to have a range of different experiences at different times, working with the nature of mind and body. I appreciate your work, Neil. Mandeep mentioned similar to the practice of focusing. Indeed, it is. I have a lot of training and experience in focusing. It's a big part of my own therapy and personal practice. And I noticed that similarity too. And we often use focusing techniques in CFD to drop in the moment, not for the compassion imagery as much, but to drop in the moment and help someone deal with the implicit level of their processing, taking time to stop and notice, sending love and compassion sincerely to yourself. Wonderful. Kurt mentioned experienced some connection to self and lost the internet connection. That's a type of connection one can lose. And Neil validating Diane. So Sarah mentions an experience of abuse and some really tragic events in her life, with death of a parent, and 13 mom passing from COPD 2 weeks ago. Wow, thank you for your openness. It's very difficult times and very difficult experiences. And Sarah mentioning, I found the focus on breath difficult because I was thinking about my mom's lungs, being unable to breathe. but looking at myself as a child and giving myself a compassionate hug felt healing. Well, I'm glad you had a moment of that in the presence of the kind of distress. That's what the techniques are there for. That's what this whole realm of human functioning is meant for, is to help us even during the hard times. So heart goes out to you, Sarah. Deborah reports feeling body sensations being relaxed and peaceful and connected to the divine. Well-being is one for her. Deborah is having a sort of dimension of this kind of the connection to higher or sort of a transpersonal intelligence, which people will experience sometimes with contemplative practice, and is certainly a part of the spiritual traditions that created a lot of these techniques that we use in CFT in some form or another. Anik mentions it being powerful to visit younger self today. And Amy talks about it feeling healing to imagine a compassionate self, offering to my younger self all of this moments of shame, self-blame, and self-harm. Marco asks, Dennis, where can we find a script of this exercise to perform it with our clients? Well, Marco, I'm going to put my website here, .com. We don't have the scripts up yet, but under, I believe it's resources and then meditations, there are recordings of these exercises. There's on one set of recordings, there's a compassionate self exercise, and then there's another set of recordings from SoundCloud where they're hosted, and there's another version of this. There's several different versions that different CFD and compassionate mind people will use, right? So the meditations are there in audio form. The transcriptions are in our book, The Act Practitioner's Guide to the Science of Compassion, and in some Paul Gilbert's books, there's similar transcriptions. Our version is a sort of adapted version of what we learned from Paul, and involves things like, focusing and the Buddhist training I've been involved with. And feel free to use those recordings freely for your own practice with your clients. And feel free, I think there's like 5 hours of HD recording there. That are specifically the curriculum from CFT and ACT training for compassion, and they're yours. Feel free to transcribe them if you want, and we have someone who's helping us with transcriptions, and when we have all the transcriptions, we'll put them up on our web too. We just have a new website, so some of the stuff's a little slow going, and I'm slow actually. Yeah, Helen mentions the technique fits nicely with yoga nidra with clients. In the Gurdjieff work, which I was involved with for, 18 years now or something like that, as well as Zen, there's a yoga nidra type exercise, which then moves into imagery, and it reminds me, CFT reminds me of that a lot. And thank you, Helen, for that observation. So let's now that we've had a taste of, the different range of experiences that can come up with compassion, and for some of you it was more evocative of anxiety or difficulties. And for many of us, it involved like the awakening of some of that compassion experience in a more direct, felt, embodied way. And wherever you are in this process of gradual exposure to affiliative affect and compassion, I honor where you are. You're exactly where you're supposed to be. Like Pema Chodron says, you just start where you are, you begin where you are. And we, like my mentor buddy Robert Fripp likes to say, we move forward from coming from, let's now, having had the experience of compassion training, let's look at each of these attributes of compassion and as they relate to psychological flexibility. And we can think about how we can integrate training for those of you who do ACT or psychological flexibility work, how it relates. And then we can also think about how the imagery itself helps us with compassionate mind training. Now, this is not a research review. This is a practical experiential workshop, but I want to add the main compassionatemind.co.uk. Okay. So this, many of you will know, is the website of the Compassionate Mind Foundation in the UK. And this is the website for Paul Gilbert and colleagues. And this specifically, I hope I spelled it right. If I didn't, just correct the typo when you put it in your, Chrome or your browser. But there's a wealth of the primary source research articles, including some from Marcelo Matos' group and other groups that demonstrate the link between compassion and psychological flexibility in terms of the research literature. Also, there's research on attachment and compassionate mind training, just given that, like an hour and 50 minutes or whatever it is that we have today, we're emphasizing an experiential, like working knowledge kind of workshop, learning this from the inside out. Lynn, you asked which book uses the transcript this afternoon. The transcript that's closest to it would be in the ACT Practitioner's Guide to the Science of Compassion, which is a book that Laura and I wrote with Benji Schoendorf as an ACT and FAP practitioner and trainer. And the link to that is available on our website too. So let's think about these attributes, the inner ring on the compassion, on this circle that demonstrates the competencies, the 12 competencies of compassion. And this inner ring are what we call attributes. These are sort of more processes, whereas the skills are on the outer ring. If you think about it, some therapies like DBT and like skills training for addictions and some forms of CBT, they're skills based. Although there's always processes and interpersonal processes, they're therapies that target skills. And then there's some therapies like relational psychoanalysis or functional analytic psychotherapy, or to some extent process-based psychotherapy or ACT, which aim to focus on processes. What I would suggest to you is that when you're training compassion and flexibility, you're working at both levels. You're working with perhaps the psychology of engagement, the discrimination and detection kind of repertoires, and mindfulness, acceptance, and motivational factors that are these processes and ongoing attributes. And you're also working with skills in the outer ring of imagery, reasoning, behavior, sensory work, and specific skills to evoke and relate to emotions and to train our attention in mindfulness and concentration. What we're going to focus on are the processes involved in the interacting processes of the attributes of compassion. And we're going to think about those in terms of their relationship to psychological flexibility. So Patty asked briefly, like, how can you use CFT with an unwilling client or patient to help them grow? So I think in a way, what we're going to be doing is using, like, cultivating these qualities and helping people to train these attributes both through the imagery, but also through the psychotherapy and the psychotherapy relationship. Meeting someone where they are and working with their fears, blocks, and resistances, grounded in a case formulation that's sensitive to their learning history. And we'll look at some examples of that, even just in this ultimate 15 minutes of our work here, right? So if you think of yourself as a therapist and we have our cultivating these qualities, the first that we begin with is an actual motive to care, like just in its essence, sort of like the tip of the iceberg of what Buddhist psychology refers to as bodhicitta, which is like the altruistic aspiration for all beings to be alleviated in suffering. And in Buddhist psychology, this is considered to be like our truest nature, our inner nature, that at our core we have this desire for life itself, for being, for differentiated being, to thrive and to go more than just survive, but to advance and adapt and be. And I think that that's at the core of the evolutionary genetic imperative. I think there's a very deep truth. It's not the kind of nicey nice kindness necessarily, but a motive to care for the well-being of living things, which is baked into our compassion motive. As human beings, we have a very low birth rate, and we have a high risk to the survival of the infant and the mother, particularly without medical intervention, modern medicine. That has to do with cooperation and cognition and reasoning and symbolic responding being our chief evolutionary advantages, and our ability to respond to symbolic stimuli as if they were real, allowing us to learn through transmission of knowledge and not just through direct reinforcement and training. Like that capacity for developing like relational, verbal, cognitive networks and then responding to them and having imagination and foresight. All of that requires like a very large brain and a large prefrontal cortex, which means that human beings are not carried in utero to a point where our brain is sufficiently developed to do the more essential human survival repertoires, like whereas like a horse or other animals are born and they have more pre-birth learning than post-birth, like verbal learning and behavioral repertoires. The horse is born and it's up doing horse stuff and able to do what it needs to do real quick. Whereas human beings, like, it takes us a really long time. You weren't born like, you know, completing NHS paperwork or driving a car or doing an ANOVA or sitting with a client or, you know, any of that stuff that we do in our everyday lives. Like, we weren't born knowing how to do that. We had to learn that and develop it. And we did that through like a brain that at first is in this soft, you know, miraculous human being that is harmless, cannot defend itself, doesn't have natural defenses. So human beings require care, provision of protection over time. And that allows us, as you heard in the neuroscience of attachment, to develop like homeostatic mechanisms that regulate threat and regulate sympathetic nervous system arousal through the internalized experience of attachment and caregiving and care receiving. So care and emotion regulation, the being in a caring mode and the experience of compassion is essential to our adaptive responding. So if you're a therapist and you know, if we think about these qualities as a therapist, like if you're a therapist who wasn't actually motivated to care for others' well-being or yourself, well, it'd be hard to do your job. You know, just sort of be, I don't know, checked out or like secretly, you know, maybe you'd have the internet in your glasses and you're watching, you know, a football match or something. I have no clue how somebody would be able to do this job with. But I know that when we're burnt out or we're only responding empathically, we're not bringing in compassion for ourselves, we're not looking after ourselves, or if we're just overwhelmed, even when we are doing those things, right? Well, we can have the subjective experience of our care for well-being be depleted. And often that's more, as Matthew Ricard and Tanya Singer describe in their research, that's more empathic distress fatigue of just remaining in states of high autonomic outflow and sympathetic nervous system overload, because as we're with our clients, the same neural networks within ourselves are activated that they're experiencing, and we just have like a neural overload, you know, just like resonance overload again and again and again, which is like really tricky and really challenging and drains us. Now, what we see is when we're not just in empathic distress fatigue, but when we're consistently practicing for ourselves self-compassion as well as other directed compassion, we become more psychologically flexible, more resilient, and we have a better preservation of our compassion motive itself. And the next quality we have, which relates very much to the psychological flexibility process of contacting the present moment, is sensitivity to the present moment. When the mind is trained in compassion, when we're operating from our compassionate mind, we have open attention with awareness, we're present, and we have clearer seeing and accurate sensitivity to external and internal contingencies with this non-judgmental, present moment, flexible and focused attention. So if we're not sensitive to what's happening with our clients, we're not going to be very good therapists. If we don't notice micro expressions and we don't notice how they hold their body, if we're not actually attending and listening to the presence of suffering or new questions or meta communications in what they're saying, without sensitivity, we're not going to be able to do the job. Sympathy, feeling with, but feeling similar or resonant feelings, describes, in CFT parlance, this describes like our emotional response to another being. So we want to be open to our ability to be touched by pain or struggle or suffering or emotions. But we also want to realize that sympathy doesn't represent like a full process of mentalization, dialectic framing, or like conceptually putting ourselves in the shoes of another being. It just involves like feeling response to what they're going through. So, if Paul Gilbert likes to use this example of a spouse coming in and saying that their partner has moved out, like they packed up all their stuff and they're gone, and then the therapist having a sympathetic response of, oh, I'm terribly sorry, that's dreadful. And then the client saying, oh my God, what are you talking about? I couldn't wait for them to leave, So sympathy isn't always like an accurate, empathic bridge into the mind of the other, but it is our emotional response to the suffering of another. It's the way we respond. So with care for well-being, a compassion motive, present moment focused sensitivity, compassionate attention, and sympathy, which relates to flexible perspective taking and the observing self, and self as context capacities and psychological flexibility, we begin to have a blend of motivation, attention, flexible perspective taking that are all part of the emergent properties of compassion and flexible responding. This leads us to the experience of distress tolerance, where our observing mind is able to stay present and be with difficult emotions without getting lost in the reactions or absorbed by the reactions, a capacity to accept. And this is the ability to be willing to engage in focused action, even in the presence of distress. Now, it's important in ACT and in acceptance training to recognize that acceptance does not represent endorsement, but it also doesn't just represent like merely tolerating something so that it will go away. My friends in the ACT community, we often will say, acceptance is more than tolerance of distress, and that's true. And people who cultivate distress tolerance in CFT and DBT will say, well, distress tolerance is just accepting difficult experiences. It's being able to bear them, being able to tolerate them, and that's true too. But I see these two qualities as being two facets, these two mid-level terms, these descriptors, as being two facets of the same diamond in our capacity to accept, make intimate contact with difficult affective and even difficult sensation experiences, to be with pain in a way that we can actually tolerate it and tolerate our distress in response to difficult experiences. So acceptance and distress tolerance are the next qualities. And if you were not able to have this as a therapist, it would be quite a bad situation, wouldn't it? If a client came in and I have some clients who, some clients I'm consulting with and about like business decisions and analytics and how to hold themselves in under the pressure of making business decisions. And I have many clients who are like going through like traumatic re-experiencing or cancer diagnoses, or chronic depression, emotion regulation problems. And if I wasn't able to tolerate distress, when we're not able to, somebody comes in and they talk about how depressed they are, how they wonder if life's worth living, and this therapist just says, oh, wow, that's really a bummer. I can't really tolerate this. I'm going to go have a drink or something. Like, that's not therapy, So we need these qualities to be present as much as they possible to respond with psychological flexibility and with compassion. And thankfully, we can train these qualities, embodying it in the psychotherapy relationship with specific practices and also with our imagery work and our meditative training. So finally, we have these qualities also of empathy, of dialectic framing, they call it in contextual science and ACT. It's known as theory of mind tasks or mentalization. This idea that we have the ability to deepen our understanding of the minds of others, or use self-empathy and imagine our mind like we would imagine the mind of another, and have a deep understanding and apperception and appreciation of what is within and without, and be able to adopt a perspective moving flexibly, as you did earlier, even in time psychologically or space psychologically, to understand the nature of our problem-solving mind and these unintended consequences of our automatic safety behaviors and self-protection and avoidance and control strategies, the ability to link personal history and make sense of feelings and motives. So empathy and reflective processing becomes essential and hugely important. Also, non-judgment, the ability to disentangle oneself from excessive influences of evaluated and judgmental thoughts, becomes essential as well. This is the three-circle model, the different affects that we work with in CFT. Just to briefly touch on this, that we're working, cultivating affective safeness, working with threat detection, working with our drives and our resources and our aims. But we're really aiming today to understand how these processes, these qualities of the psychologically flexible, compassionate mind show up in ourselves and in others, so that we can help others bear their own suffering, and that we can move from simply detecting threats to basic caring to a full, compassionate, interwoven, interconnected, psychologically flexible responding mode with all of the attendant experiences of the polyvagal system with secure attachment and the hormonal and neural and physiological response to attachment, where we've internalized our experience of lasting psychological connection, which allows us to regulate our response to threat, coordinate our systems, and to follow this embodied experience of compassion and care so that we can move towards what matters most to us and have lives of meaning, purpose, and vitality. And if we've had impingement trauma or adverse childhood experiences that make us less psychologically flexible and have a hard time experiencing safe base, secure base, and that compromise the system whereby our experiences of affiliation and soothing and our ability to activate our networks of compassion allow us to respond flexibly in the response to threat. One of the things that we do through training in compassion is we take our unintegrated, chaotic minds and we cultivate differentiation and integration, which allows us to move towards flexible responding, to shift from competitive and threat-focused motives to a caring motive so that we might evoke what Dan Siegel describes as a prefrontal mediation of our response flexibility, which emerges from compassion and secure attachment dynamics that allows us to integrate and incorporate many different levels of functioning, which enables new and personally meaningful responses, flexible responding, flexible perspectives that lead ultimately to this experience of psychological flexibility in the present moment, flexibly responding, returning again in kindness to a compassionate mode of experiencing, which manifests the qualities of psychological flexibility and manifests the qualities of compassion. So these slides, I believe you can contact Weekend University, contact Niall. These slides should be available and circulated to everyone so that you can reflect on how we can integrate the psychological flexibility model with the compassionate responding model and bring this forward into the world. I really appreciate the opportunity for everyone to be here. We didn't break out a specific 20-minute walled off Q&A experience, but we merged that through our reflective question period and throughout our exercise. So you've been a wonderful group, an engaged group. I wish we had longer too, but just think of this as an entree. If you would like, if you go to our website, mindfulcompassion.com, or if you email me at vip@mindfulcompassion.com, or go to mindfulcompassion.com. You can join our training listserv, and we'll send you lots of different trainings and opportunities to learn more about how these processes can work with together. So thanks so much. Thank you, Niall, for having me, and deeply, deeply appreciate being involved with your work today. Okay, thanks so much. Take care, everybody. Lots of love.